from Bombay Multi Speciality Hospital, Surat. I'm a practicing gynecologist for almost last 25 years. Previously, I was at Mumbai. Now I'm in the city of Surat, and I'm the chairperson for Gujarat IMA Mission Pink Health. So, working for women is my passion, and especially when we talk about women, Baby Chakra is one platform which needs our help all the time, and we love being here again and again. So it's really a great opportunity. So women means one who nurture the society, who take care of the families, and especially bring new life on this planet Earth. And if it wasn't the women carrying the babies in their wombs, the human race would be how I really can't imagine. And after nurturing the baby in the womb, also it's afterwards the breastfeed from the mother, which gives the main ingredient of resourceful life, like from day one of life until the time the baby is actually on independent life. The mother keeps nurturing, and then that is the very important role I feel of women. And being a women health practitioner, I think it's our responsibility to share what is good, because in this journey of life now, women are not only sitting at home, they're all working, and not only working in the homes but working everywhere around, from the Mars to the moon. Everywhere around, I find women in all kinds of professions, and let it be homemakers, but they are really having a lot of inputs in our lives. So, nutrition is what? Nutrition is something which nourishes you. And nourishment is one thing which is important for all species, not only mankind. So, depending on the anthropometry, what is anthropometry now? Anthropometry is like what is my height, weight, age, and my basic metabolism. So, all that will decide what kind of nutrition should I be taking as a lady. And then, when I'm planning a pregnancy, or I'm pregnant, or I'm feeding a baby, that time it is all the more important. So, what are the changes which happen in the peri-pregnancy period? There are a lot of emotional changes. Whenever a lady is planning a pregnancy, she's undergoing a lot of stress. I mean, working women, especially when they come to us, they want to know, doc, what will happen? How will it go? Will I be able to continue with my work? So, emotions play a very important role, and it's a lot of stress and the related steroid hormone release. And of course, there are physiological changes of ovulation, then periconceptional period, and during conception. So there are a lot of physiological changes happening. There are a lot of mood swings happening, and then naturally, when a lady is pregnant, everything changes from her fluid in the body to her weight in the body, and the GI changes which are involved. So much so in IVF pregnancies that so many injections are being pushed into the system, which change the metabolic balance of the body. So, depending on the body weight and the mother's lifestyle, a basic diet plan should always be provided to all the ladies who are planning a pregnancy or are already pregnant. And the basal metabolic rate plays a very important role. Those who are having a sedentary lifestyle, their weight gain should be different. And those women who are working or having daily workouts and are having a very active kind of a lifestyle, a few of them are athletes also and are continuing with their pregnancies with the workout, the diet pattern has to be different. In Indian system, it is like तुम अभी pregnant हो गए हो, तुम लोग को दो लोग के लिए खाना है. But the baby's growth is actually in the first 3 months only happening at the rate of 5%. And then the growth rate changes from the second trimester to the third trimester by 12%. So first 3 months mein so many times the mother actually loses weight, 2 to 3 kgs, and more so in cases of thyroid pregnancies. But in the second and third trimester pregnancies, most of the mommies gain weight. So the energy requirement, the calorie requirement, especially the protein requirement is changing. And if you take it well, it works well in the favor of your immunity. And in pandemic times, it's very, very important that you have a very good immunity. Now, the secretions in the saliva, so many times there is bitterness of taste because of the pregnancy, and then the mothers can't chew food well and they can't gulp it down, and so many times there's hyperemesis, they are feeling nauseated and can't eat anything. So in those times, sometimes the IV nutrition is also needed for some mothers, and some kind of special mouth dissolving nourishments are also given. The overall weight and the fluid balance is changing, so the mother needs to improve the amount of calories she's taking on an average. 300 to 500 calories for each mother need to be improved slowly over a span of time, especially from the fourth month onwards. And जो हमारे में घी खिलाते हैं ना mothers को in the last month is actually very good, because in the last month the placental growth is complete, and that is actually making the baby chubby. But if the weight of the baby at the birth time is in the range of large for gestational age, then that leads to diabetes and cardiac issues in the babies. Now, these days, we are finding so many babies which have diabetes from birth or in the pediatric age group. India is one of the leading places in the world where diabetes is found, and especially in the childhood. So, childhood obesity, childhood hormonal issues, especially thyroid issues, childhood diabetes is very, very common, and it's the nourishment the mother has taken periconceptionally, during the conception time, in the pregnancy, and post delivery. How she has taken care. It's not only the food you take, it's what exactly are you taking. So must meet a dietitian, must meet your doc before planning a pregnancy, and throughout all visits. You must know what how much amount of vitamin A is needed by my body, vitamin D, calcium, magnesium, zinc, iron, and there's so many supplements which in small micro quantities, micronutrients are leading good results, like folic acid, 5 milligrams a day, but avoid so many complications for the baby. The neural tube defects are avoided, hyperhomocystinemia is avoided, abortions are avoided, and we have a healthy baby. Similarly, if we don't have enough iron, the placenta enlarges, anemia leads to different kinds of growth in the baby, and these babies have developmental defects and low IQ babies delivering early, that is preterm labor, and then hypertension if the calcium levels in the mother are low, and if you supplement those calcium levels and protein levels, the hypertension is almost not there in most of the mothers. Similarly, if B12 deficiency is there and that is added on, the mother has a very smooth pregnancy. Most of the abruptio cases, placental issues are solved by providing these micronutrients. So this is the importance of nutrition care during pregnancy. If the mother has to nurture the fetus, actually she has to start after marriage. I say the premarital counseling is very important to choose the kind of partner, and then pre-conceptional partnering is very important to choose the kind of baby you're going to have. Otherwise, we'll end up in premature births, growth retarded babies, childhood diabetes, abnormal babies, recurrent abortions, hypertension in pregnancy, diabetes in pregnancy, hormonal issues, as well as thyroid defects in the pregnancy. And all that the mother says, I never had it before. Like, I'm 30 years of age, I never had it before, but now why am I having it? Because the pregnancy itself is a stressful condition. There's a lot of change of the hormones, the GI system is changing, there's load on the liver, you can't breathe well after 8 months of pregnancy because the lungs are expanding, so your cardiovascular balance is changing. And if you can't take good care of yourself, how are you planning to give good life to your upcoming baby? So nutrient need definitely increases, but in different mommies at different ages, at different gestational ages, depending on the blood parameters and the growth of the child, the scan report, the personal guidance is needed one on one. On the first trimester, most of the time it is folic acid, B12, and carbohydrates which are needed. But from second trimester onwards, more of calcium, iron, and protein intake is allowed. And whatever deficiencies are there are specially taken care of. But if we are not able to do this, we should be prepared for poor pregnancy outcomes, poor neonatal outcomes, pediatric mortality, a lot of morbidity and suffering in the newborns, and nonetheless, the lifestyle disorders at an early age in the kid. So many kids keep visiting us after delivery just for rhinitis and upper respiratory tract infections, diarrheas, poor growth, poor IQ, poor performance in all fields of life. And that is because during the conception time and the womb phase, the care was not given. Now, working women are sometimes not able to enough breastfeed their kids, and the nutrition herself is not proper because she's working. She doesn't have time to take much care of herself. So, mommies, I would request strongly that even if you are at your workplace, take care of how much amount of protein is needed. On an average, 25 to 40 grams of protein needs to be increased from second trimester onwards till the time you're breastfeeding. And that is possible if you're taking 2 3 eggs a day is also fine. You're taking 2 3 protein shakes is also fine. So many supplements are available with the advice of a doctor. Please don't go for products which are provided in gyms or by some trainers until you have consulted your personal doctor, because so many times the type of protein which is provided in the gym is for more of muscle fitness, and what we are looking forward to is the overall health. The fitness trainers will not be able to take care of the kidney and liver metabolism. Your personal doctor will always know what is the kidney functioning and how is the liver responding. So to take care of liver and kidney and then add on proteins is important. Many mommies have higher uric acid levels, and if more protein is added, the hyperuricemia leads to lot many complications and also joint pain. And then we add on painkillers, so that damages the kidney. So how much protein, which form of protein, from when to add, when to stop, all that is to be taken care by a specialist. Like it's not that anybody can take because you have joined a gym or you have joined a yoga class during pregnancy. So whatever is being given there, you just go on. No, you need to personally consult your own doctors. And after the delivery, if you want to increase metabolism, the simplest thing to increase metabolism is improve the fluid intake. The body undergoes blood circulation regularly every 1 hour. Even if you're working, you can take half a glass of lukewarm water. Morning, you can add honey and lime juice. And every 1 hour, if you take 10 deep breaths, even on workplace, like 10 deep breaths every 1 hour will improve your metabolism. Second is every 1 hour go for some steps. Maybe you can have a tracker in your watch or in your mobile or gadgets which you use. So 10,000 steps a day not possible during working hours. Okay, but whatever number of steps are there, you can make them more brisk. Every 1 hour, keep visiting nearby places in the office for some work. So you can increase your metabolism. And when you start your day, if you add little bit of cinnamon in your tea or coffee, it improves the metabolism. Similarly, yoga, chair Surya Namaskars, even in offices they are possible. Lot of simple yogas after finishing your meals, like Vajrasana, they improve your metabolism. So we can always have one-on-one sessions depending on the lifestyle and the exact metabolic rate you want. So these simple tips help us a lot to regulate the body weight as well as have the best results from the nutrition we are taking. Suppose I'm eating well, but if I'm not metabolizing it well, like now, recently we had a bone density camp, and for all the pregnant mommies who were under our care, the bone calcium was normal. But the youngsters who had come with them, suppose I'm a pregnant mommy, I'm 30 years, and I have come for the bone density test. My test is normal because I'm under care of Dr. Sonia. But then my sister has come with me. She's 25 years of age and she's not even pregnant. Her bone calcium was lower. So youngsters are having a lower bone calcium because of the sedentary lifestyle. They're sitting on the sofa all the day, couch, doing nothing. In pandemic times, it has increased rather more. And the type of food habits, more of junk food, less of healthy food, less of raw food, all that is causing a lot of issues. So any other questions you all have, Shivani, Trisha, Naina? I would like to answer, otherwise I'll move on. So iron, on an average, if we give a 100 mg tablet, only 5 to 6 milligrams is absorbed. So, one tablet a day is essential, especially in mothers who are anemic. And folic acid should be continued till at least 5 months, because even in thalassemia and sickle cell anemia mothers, the folic acid helps regulate the amount of hemoglobin. And in case you're giving folic acid for anemia or iron for anemia, protein needs to be added, because hemoglobin is two parts, and globin. So globin is the, don't give enough amount of globins. Like egg has albumin, but the routine other essential amino acids, essential fatty acids need to be added. And if you're taking it at the wrong time, the doctor is giving you pills, but you're putting it in between the meals or taking it with some tea or coffee, then it's not going to get absorbed. So it's very important. One very good question is, what is intermittent fasting? Now, actually nowadays the kind of lifestyle we have, one meal a day is sufficient. And in case you want to have two or three meals, then the difference between the two meals can be around 6 hours. But then if the rest of the 12 or 18 hours of the day, if like you're lying down in the night time and you're not working much after the sunset time, so that time if you can fast, the body's dead cells, scavenging cells, will be taken care of by your system if you're fasting. So intermittent fasting does help. Once a week liquid diet does help. Taking only raw foods, like only a fruit diet once a week, does help. Taking only soups, coconut water, less spicy food, fresh foods does help. Intermittent fasting has its own benefits but should not be done much by pregnant mommies who are diabetics or hypertensives. But overall, for the people who are not spending much of the calories, are sitting in the office or at home most of the times, not doing actively physical work, should be allowed to do intermittent fasting. Your sugar levels need to be checked every 15 days during pregnancy if you're following this kind of diet. In case you feel hungry in between, you should listen to your subconscious and add on some protein shakes. But then overall, I'm a great supporter of intermittent fasting. And that also regulates the quality food you're having. If you're munching anytime anything, then you tend to have more of junk food. But in case you are aware about your meals, the timing of the meals, the chances are higher that you'll be taking proper nutrition which is needed by your body. And in between, you can always add on coconut water or some lime juice or a green tea or a green coffee or lukewarm water. All these things support you to fast and then utilize to the max the amount of nutrition you are taking. So and this I wanted to share all this with all of you. Any other questions you have, I'll be happy. For the breastfeeding moms, also over and above, we want to add at least 5 grams of sugar, 5 grams of salt, and 5 grams of pure ghee every day. It helps the mother cope up with the changing phase of having less sleep, contributing more for the child every 2 hours. And even for the working moms, like we tell them that you must meet your kid during your work time, especially if it is nearby place. So once during the working hours also, you should come back, feed your baby, and then leave the rest of the milk stored, and then the baby could be fed with the milk. But in case there is lactose intolerance or the baby doesn't tolerate milk, then we have some kind of special top feeds available. But Indian mommies over and above these days, I'm observing, are very very aware, and as soon as the baby is born, we are putting the baby on the breast and the baby starts suckling very well. The bond is immense, and it overall leads to good intelligent babies. Very very supportive parents these days. The spouses are also very supportive. Like what was the scenario 10 years before and what I see now, the couples are very interactive and staying single also in nuclear families, but they're taking wonderful care of their kids, especially with the knowledge available all around the world, and being able to share in this pandemic online. It really helps. So any other questions, Naina, you wish to ask? For the kids also, the breastfeed is the best. But then in case you want to add on, you should add with the permission of your pediatrician only. and the type of milk is different for each child. These days we have Yashoda milk banks also, in case the mom is not able to produce enough milk. The milk banks do provide, and we actually have made mommies groups, and these mommies are able to contribute to the other babies in case the mother is having chemotherapy session, or is having some such disease where she cannot feed the baby, like it happened so in COVID times, that the mothers were really unwell and the babies were delivered in emergency, and the babies were kept separately from the COVID moms till the mom recovered and she couldn't feed the baby well. So these were the babies who were taken care, and all these milks which were given as a supplement to the child were added with vitamin A and all the nutrients which are needed by the growing kid, and every kid has a different kind of development chart. So like how is the height of the baby or the length of the baby growing, the weight, like in 3 months time the weight from birth should double up, and by the end of 1 year the weight of the baby should be tripled from the birth weight. So if the growth chart is maintained well, most of the babies will not have diabetes at early age. But in case if you're overfeeding your child, and if you're giving too much of top feed and pushing in, the baby is going to get more chubby. Maybe you like the chubby cheeks, but then it leads to developmental disorders, sometimes thyroid, sometimes early childhood diabetes, and then the baby is on insulin because it is a different type of diabetes from what we see in the later age. So let us help India to vamp out all the diabetes from proper care of the nutrition in the womb. Very active mommies who are aware of what they are nourishing themselves with, and being active at workplace also, it is possible. Once you decide it, everything is possible. And similarly post birth also, if the grannies are overfeeding the babies, you can always tell them this is the nutrition chart. Maybe you can have a group discussion with the family of your dog, and then everybody aligns their energies and thought processes, and according the babies are fed, and the mom doesn't eat for two, but she only eats for what she is prepared to, because post delivery दादी को weight lose नहीं करना पड़ता. It's the mom who has to lose weight and get back to her original body shape. So she has to have a very good body image and has to be an active mom. And the pregnancies which are at a later age, like 35 years and above, also need a special kind of nutrition. They are not allowed to take much of salt, and even if they want to taste the salt, it should be low sodium salt, because hypertension is very common, and this hypertension can lead to serious disorders, sometimes convulsions. But if you reduce the salt, increase the proteins to around 1 gram per kg of your body weight, or 1.5 gram per kg of your body weight, like your weight is 50 kg today, so you need at least 50 grams of proteins, maybe 50 to 60 you can say. So the protein jars which you have noted the amount of proteins in it, like it's 200 grams ka dabba. So if you divide it 30 grams a day, you know it's going to be over in a week's time. And if you add that, your diabetes goes low, your hypertension goes low, you have very good immunity, your baby is getting the best nutrition, the immunity overall improves. So these simple things can give you big results. Like avoid the problems which are going to come to you and your kid 2 3 decades later, only through having proper consultations, timely nutrition, calculated calories, and then checking it every 15 days how it is, and tracking your lifestyle. How active are you, and how active you should be for your age and metabolism. So I hope I have shared enough. And then if there's any query, we'll be sharing the helplines. Again, I'm thanking Baby Chakra team, especially Naina, who connected to us. And we really feel great always, because you give us this opportunity. Thank you so much. And I want to thank Dr. Gaurav also. He's with me today because he helped me out. Had a very busy day today, and we had some audits also going on. And the team at BMSH who supported me
Yes.
overall. So thank